Venom piercings. Going to go through the pros, the cons, the advantages, disadvantages. Also going to cover things like what you should do to prepare for the piercing, what you should know in advance, getting the piercing done, healing the piercings, living with the piercings, jewelry, and what happens if you say, I don't really want this anymore. Coming up next on Pros and Cons by Piercer, Season 2, Episode number 88. For those that are new to the channel, welcome to the Body Piercing and Tattooing channel. Hope you're enjoying the videos, hope you find them helpful and useful, but you may not know who I am. My name is DaVo. I'm a professional body piercer and have been since 1994. I own and I operate the Axiom Body Piercing Studio, located right here in Des Moines, Iowa, inside Skin Kitchen Tattoo. So Venom piercings or Venom bites are a tongue piercing. It is two barbells done side by side, off center slightly, usually done where a midline tongue piercing would be. Basically, you have to have the anatomy for this. This is not a really common piercing, and it is kind of one of the only tongue grouping piercings that I really suggest or that even exists. I guess there's the midline, but there's really not a special name for it. There isn't a bite for the midline when you do multiples. Doubles, maybe? I don't know. The internet hasn't came up with a new one. As far as history, the tongue piercing and this piercing developed, the tongue piercing started in the late 80s. The Venoms came a little bit later, I would say mid-90s or so. They're completely modern. There's not really any connection to any, there's some rituals that involve piercing the tongue, but as far as wearing a piece of jewelry in your tongue, that is a new thing. That's only been around about 30, 40, about 40, 45 years. Now, let's get into the pros, the advantages, the things that make you go, hey, this might be okay in my life. Starting with number one, has a long history of healing. Tongue piercings heal pretty well, pretty quickly. They're not prone to a lot of problems. They can be a very frustrating piercing to get done. Lots of swelling, lots of adaptation to having it in there. There's soft food diet, etc., and we'll go into more of that. So it's not the easiest heal, but it is one of the fastest ones. Number two, easy to hide. If you don't play with the piercing obsessively and you don't open your mouth really, really wide, some people will never notice that you even have your tongue pierced in the first place. Now, because there's two of them, it's a little less easy to hide than, say, a regular midline tongue piercing, but most people don't always notice that you have it. Number three, it is a quick heal. Kind of already mentioned that, but let's go over it again. Usually these heal out in about 2 to 4 weeks. When you compare that to a majority of piercings that can take anywhere from 2 to 3 months all the way up to 6 months to a year, this piercing heals very rapidly. Number four, venom bites can be done in stages. You don't have to get both of them done at the same time. You can get one side done, heal it out, deal with it, get used to that adaptation, and then do the second one. It's often kind of been an inside kind of thing that a lot of people don't know, but I learned early on when redoing tongue piercings on individuals where they left the jewelry out too long and we just had to re-pierce it. Usually the second time around was much easier. The adaptation was a lot faster. The eating, the non-soft foods came a little bit quicker. So getting that first one done and going through all that misery the first time and frustration, and then getting the second one, sometimes doing it like that, getting over it, and the second one tends to be a little bit easier to deal with. Plus, depending on what your budget is, what you got going on in your life, maybe healing out one at a time is a better option for you. Number five, this is a rare piercing grouping. I don't see it as often as I see lots of the other bites. We see lots of spider bites, lots of snake bites, lots of angel bites, but it's not that common that you see venom bites, and that's partly because of anatomy needs, which we'll get into probably in the cons. Now let's move on to the cons, the disadvantages, the things that make you go, no way am I dealing with that. Number one, This has a risk of additional damage, even over a midline tongue piercing, to enamel erosion, gum erosion, softening the bones. It's going to take up a lot more space in your mouth. The adaptation may be a little bit more tricky and more frustrating, and you're moving closer to the teeth that are on the to your teeth. Also, the roof of your mouth is dome-shaped, so it's more prone to hitting contact with gums and the bone structure on the top of your mouth. So there is a higher risk of those problems over a normal tongue piercing, and even with a normal tongue piercing or a midline piercing, those risks are still there. So you need to know that going in. Number 2, you have to have the right anatomy for this. There has to be space in there to allow room between or for the jewelry that isn't going to come in contact with those very large veins or blood vessels that are on the underside of your tongue. Clipping them or cutting them or even being too close to them can cause severe bleeding that can take a long period of time, and worst case scenario, you end up in an emergency room because it won't stop bleeding. It is one of those ones where you have to have the right anatomy. Add to that the fact that phlenium tendon needs to be in the right position. There needs to be room in front of it to allow it to pierce it properly. That adds a lot of anatomy needs for this particular set of piercings. Number 3, with any oral piercing, swelling. It sucks. This one, it will be pretty bad. Tongue piercings are probably the one that swells the most and impacts you the most as far as daily normal activities of all oral piercings. Swelling can last anywhere from 3 to 5 days. The tongue can kind of almost double in size in some cases. It makes eating frustrating. It makes talking frustrating. It makes life a little unhappy. You're going to need to make a diet change to reduce the amount of swelling you see. Lifestyle changes, etc. So swelling is a big con with any oral piercing, but especially with tongue piercings. Number 4, even if you have the right anatomy and we get well away from those blood vessels, these do tend to bleed longer than other tongue piercings. They can bleed a couple days in some cases. Not profusely, but there'll be like a slight bleeding off and on. You'll have that metallic taste in your mouth, etc. And these are just prone to that. And number 5, like all oral piercings, tongue piercings, etc., these close very rapidly. They are one of those piercings where you really need to just leave that jewelry in there indefinitely, only taking it out to replace it. Now, with that out of the way, with the pros and cons out of the way, let's move on to preparing and what you should know before getting the piercing done. I always advise this of any oral piercing, that you go out and you get a nice full meal before you come in and get pierced, maybe an hour or so beforehand, or eat something at home that you really enjoy. Your diet is going to be changing profusely for about 3 to, if you're lucky, but more like a week. So going out and having something that you really enjoy eating that's complicated and you're not going to be able to get anywhere near for a while is a good idea. Not only because it kind of satisfies that for a little while, but also it gets that blood sugar up, puts you in a relaxed mood, which is going to make the whole piercing experience a little bit easier to get through. The second one is in advance. If you are involved with school activities, school, jobs, acting, whatever, you talk a lot, you have an upcoming, you're in a band, you have an upcoming gig, consider these things beforehand. If there is a dress code for whatever activities you're involved with, check with the people in charge before you get the piercing. Nothing is worse than showing up to practice or what have you, or a game, or a performance, and realizing that you have to take your jewelry out or go home and not participate. Now, you should find a piercer that you feel comfortable with, that is knowledgeable, has a lot of experience doing these, can easily read your anatomy, also is open, willing, and passionate to teach you as much as you could possibly know about that particular piercing and how to care for it. Meaning, they're going to do a consultation. They're going to check your anatomy. They're going to go through, they're going to tell you why you're good or why you're not good. They're going to talk to you about what the proper jewelry is going to be. They're going to go through the aftercare instructions verbally, and they're also going to probably give you written instructions. Well, I would hope. It's best to find somebody that is willing to do this stuff up front, that doesn't kind of mask it, and yeah, here you go, fill this out. Here's a QR code, see ya. One of the things with the consultation, they should cover what it's going to take to heal it, but they should also cover the risks that are involved with getting this piercing, downsizing the jewelry on a regular, within a reasonable amount of time, and all the risks that are involved and how this is going to change your life. They should do all of that before they even consider handing you a waiver and making you fill it out. The next one is you either have the anatomy for this or you don't have the anatomy for this. Don't just because, I mean, it's great to get second opinions. Some piercers, they may have a little bit more experience doing this, or maybe they like to take risks. But I've come across people that have contacted me later after I've said, no, we can't do that. And said, I wish I would have listened to you because I went to this other place and they were like, oh yeah, let's do it. And then I was in the emergency room 5 hours later trying to get the bleeding to stop. And I wasted all that money and then I had to pay a doctor's bill. So listen to your piercer. If you find somebody that you trust enough to do these piercings and they say, that's it. Move on. Find something else to do. And that brings us to the next one, which is your piercer should have some experience with this particular piercing. It's not a common piercing. It's pretty rare to do this grouping. So really kind of do your research ahead of time. You're going to be better off in the long run. Maybe the best option is traveling somewhere where somebody has a little bit more experience with it, and doing that little bit extra investment to just get it done right. Now, you're going to have to practice cross-contamination prevention. Things like with this particular piercing, the main ones are avoiding sticking unclean objects in your mouth, no deep mouth kissing, oral contact, or sexual contact for a minimum of 8 weeks. You need to understand that you are going to be more acceptable to STDs during oral sex. So if you switch partners, practice safe sex the way you're supposed to. The other thing is you want to make sure your utensils are cleaned on a regular basis, and you do not want to share items with utensils and et cetera with other people and food items. Now, diet change, I'll go a little bit more in depth with later on, but you're going to be on a soft food diet. We want to limit the amount of movement that you have just to cut down on the swelling and discomfort. So simple foods are going to be your best friend, especially in those first 3 to 5 days. It's not going to be fun to try to eat pizza or steak or, I don't know, a taco. The last thing is, and I kind of alluded to this, but I didn't really talk about it, downsizing. This jewelry will need to be downsized, and I suggest 7 to 14 days. And the reason being is that having that longer post in there to allow for the swelling is one thing, but leaving it in there after the swelling has gone down just increases the likelihood of you catching it on teeth, it having contact with the roof of your mouth and gums and enamel, and you're more likely to play with the thing, which is going to increase the likelihood of all those risks we're talking about. So downsizing on a timely basis is very important. Talk to your piercer about that. Talk about what they suggest or when you should come back to get that done. Now let's talk about the piercing experience itself. Consultation. Go through that. Sizing. With jewelry sizing, we tend to put longer barbells in than what we would normally do in other piercings because we usually see a lot more swelling with this. Usually about 1/8 of an inch longer than what you need. A lot of people are kind of confused by sizing tongue piercings. Your tongue expands and contracts a lot. So even once that piercing is healed and we downsize the shorter barbell, we still want a lot of room on there for your body to expand and contract, or the tongue to expand and contract comfortably. Next thing we're going to do after we've gone through everything else, so we're going to go through a waiver And on that is going to be things like, of course, consent to do the piercing, verification of age. Also, it's going to ask things like if you have any health conditions or you're on any medication that may cause issues during the piercing or after. And be honest about that. Also, if you have any allergic reactions to anything or allergic to anything that you're aware of, so that we can avoid the possibility of you having an allergic reaction to something. Be honest, fill it out. It may keep you from getting the piercing done. When it comes to health issues and medication, if you're unsure about it, you can ask your piercer, but they're not a medical professional. They have access to pretty much the same information that you do. It's always best when in doubt, ask a professional medical person. So once that's all done and we've sized things, we checked your anatomy, and we're ready to go, we'll wash our hands, of course, scrub up, and then begin clean, disinfect a tray, lay out our drape, start setting the tools in there that we need. Then we'll don a set of gloves, unwrap it, and set up to do the piercing. Next, we'll disinfect the area and mark it. With tongue piercings, usually this will involve rinsing with maybe a antibacterial, alcohol-free antibacterial mouthwash such as Biotine. Then we mark it. When marking, we're basically looking at that curvature. We want it to match the curvature of the tongue. The tongue isn't flat and straight. It kind of tucks upward at the end. And it should be in front of the flornum tendon, which is that tendon on the underside of your tongue, and slightly off center. There should be a little bit of room between the two of them, and they should match or look like they match. Sometimes we'll do them at angles, so they'll fit a little bit better in either way, depending on the structure of your mouth. So we match it to that. I always have clients either take a quick look at it, just to feel like we're both on the same page. And it may make sense to you, and it may not. So take a look at it, ask questions. If you feel like it needs to be adjusted or they're not matching, talk to your piercer about it at that time. With this, I use Bollinger forceps. Those are kind of a rounded tip forceps. We clamp down the area, inject the needle in and through. I use threadless needles usually or threaded needles on this, so it's already threaded on there. So it's kind of pierce, barbell in, take off the bottom, or take the needle off, thread on the ball, take off the forceps, and we're done. If we're going to do both of them in a sitting, we repeat it again. Another option would be either using a guide pin, where basically the only step is that you put the guide pin into the needle gets pushed out, and then you take the guide pin off and thread on the jewelry. There might be some moderate to slight bleeding off and on for about the first few minutes. Sometimes, like I said, these will kind of ooze blood over a long period of time. You'll have throbbing, aching, discomfort. One of the biggest things about getting this piercing done, it's not really an overly painful piercing to get done. Most people say on a scale of 1 to 10, it's about a 2 to 4. However, it feels really weird not to have control of your tongue. And it is difficult to keep your tongue out of your mouth for a long period of time. So it's not uncommon sometimes to get kind of some tightness down here in the muscles afterwards that lasts a day or two, kind of like you got you're getting kind of a head cold or something. That's pretty common because you're stretching out that tongue in ways that you normally don't do, and you're keeping it out for a long time. The other thing is the drool. Everybody drools during tongue piercings. I always put on a bib for the person, or put a bib on the person, and give them a drool rag. I just do it. Let it flow. Don't try to stop it. You can't swallow with your tongue outside your mouth. That's part of the problem. Just be sloppy. It's one of those times in life where it's expected and probably is acceptable. Now let's talk about healing. Healing the piercing, I generally suggest rinsing twice daily using an alcohol-free mouthwash. Biotin antiseptic mouthwash is generally what I suggest. You can find it pretty much anywhere that sells mouthwash. I'll try to tag the product in here too, if you're in one of those parts of the world where it's not easy to find. The other thing I would suggest doing is warm saltwater rinses a couple times a day, about 1/8 of a teaspoon per cup of warm water. And that's more to kind of take the edge off things and make it feel good. Kind of like when you have a sore tooth or a toothache. It kind of makes it feel better and kind of draws things out. Now, swelling is a big factor with any oral piercing, but especially tongue piercings. It's going to last anywhere from 3 to 5 days. To reduce that, you want to cut down your intake of tobacco, alcohol, cannabis, hot and spicy foods, things that are extremely warm in temperature, or anything that may agitate your mouth. If it hurts to ingest something, don't do it. That includes vaping. I don't know why people think they get a special... Oh, vaping doesn't do that. Yes, it does. I've also had a lot of people ask about cannabis. It's how you are, when I think of cannabis or more traditional way of smoking it, it is an anti-inflammatory. So if it's gummies or some type of food type product or drink, it may be okay. But then again, you're dealing with something that's complicated, maybe hard to chew, hard to get through there without catching the barbell or getting stuck on the barbell. So buyer beware kind of situation, but it can help a little bit with the swelling, but smoking it, absolutely no. Anything that you're inhaling, no. For the first 5 to 7 days, I would suggest being on a soft food diet, things like yogurt, baby food, applesauce, nutritional shakes, smoothies, ice cream's fine too, or shakes in general. Pretty much cold items and things that are easy to ingest and don't involve a lot of chewing. I would avoid anything that's going to be complicated or you have to move around your neck or you move around your mouth with your tongue, things that catch. Like, for example, you don't want to eat peanut butter. You want things that just kind of go down the pipe pretty easily. Once that swelling is reduced, you can slowly start to wean yourself onto solid foods. I really suggest stick with kind of bland foods, but simple foods, things that you can kind of cut up in pieces and shove back into your molars that don't involve a lot of chewing or moving around in your mouth or tearing off and then chewing. Like beef jerky, not a good idea, but, small pieces of meat might be okay. Other ways you can reduce swelling is sleeping with your head elevated above your heart for the first 3 to 5 days, drinking lots of cold liquids, lots of cold items. Gently sucking in ice chips for the first couple days is really going to help and keep you hydrated and feel good, especially at night when your body naturally dehydrates. It tends to swell more, and by morning it's a lot larger than it was when you went to sleep. So staying hydrated throughout the night can help with that. If you do not have any problem taking over-the-counter anti-inflammatories or don't have a history of it, like ibuprofen or Tylenol, they may be okay. I can't tell you to take them because I'm not a doctor. And if you're in doubt and you've never used it before or you're taking a new medication or what have you, get in contact with your medical professional and find out whether or not that's going to be an issue. The next thing is don't play with the thing. We say this on every piercing, but this one is really hard not to start playing with that thing that's in your mouth. I have clients sometimes where I'll go through the aftercare, and the whole time I'm going through the aftercare until I get to this point, they're dicking around with that thing. Playing with it, obsessive movement, obsessive talking, etc., is going to increase the amount of swelling you see and prolong it. If you have a job or an activity where you talk a lot, it's best to do this like if you have a 3-day weekend so you can get it done on Friday and have those 3 days of not having to deal with that. It is going to cause some speech issues anyway, so it's usually best do it when you have some time where you don't have to talk a lot, and please don't play with it. Now, you must cross-contamination prevention. I already covered this for the most part, but let's do it very quickly, real quick. Avoid seeing unclean objects in your mouth, pin caps, toothpicks, etc. No deep mouth kissing or oral contact for a minimum of 8 weeks. You are more acceptable to STDs during oral sex, so if you switch partners, practice safe sex the way you're supposed to. And that's indefinitely, even after the piercing is healed. Do not share food items, utensils, and etc. with other people. Make sure that your own food items or utensils are cleaned on a regular basis. One other thing is I would stay away from any type of toothpaste or anything that's whitening. That can cause some issues. If you normally rinse with alcohol-based mouthwashes, I would suggest cutting that back until after the piercing is healed. This piercing can bleed off and on anywhere from 3 to 5 days. Gently soaking in ice can help slow that down and help it clot. It's just part of this piercing, and sometimes when we're so close to those blood vessels, there's a bigger supply of blood, so it's more prone to that than other piercings. Like I stated earlier, you want to downsize this jewelry in roughly about 7 to 14 days, not only to cut down the likelihood of damage, but to make your life a lot easier. Most studios will offer a discount when they downsize and not charge you for it. That varies from piercer to piercer and studio to studio. If you're unsure about it, contact them or ask while you're getting pierced or during the piercing thing. Now let's talk about jewelry. Jewelry should be left in at all times indefinitely. Oral piercings, especially tongue piercings, close very rapidly. This one has two going against it. It's an oral piercing, which means you generate tissue very rapidly, and also it is a long piercing or thick piercing, which means that it's easier for your body to compress that tissue and reconnect it. So only take out to replace. Don't leave the stuff out for a long period of time. With tongue piercings, I generally suggest threaded jewelry. You need to check those ends on a regular basis. It is not uncommon for them to come unscrewed. They will do that usually when you're eating or sleeping. That's like the two most common periods of time that it happens. Mouthful of food or you're unaware the thing is unscrewed. Do it at least once a week. Pick a day of the week, and that's ball checking day. Every week, religiously. As far as jewelry type, titanium or implant-grade steel or 14-karat gold are the only three options you're really going to find and what I suggest. Titanium is pretty much the standard at this point in the industry as far as biocompatibility. Internally threaded is also pretty much standard. Internally threaded is where the ball has a piece of threading off of it and threads into the post, opposed to the old style where the ball or the post has threading on it and the ball screws onto that. Basically, the advantage of internally threaded is usually it takes more turns for it to tighten or loosen. Also, it's easier to countersink it where there's less of a gap. And you don't have that threading rubbing against that piercing every time you take that jewelry in and out. This can be an issue, especially with tongue piercings where, forcing that threaded jewelry back through and or with all that threading on there can damage it. Cause slight tears, and then you're starting the healing process over and over and over again. So, always internally threaded. During oral sex, if you're with a new partner, practice safe sex the way you're supposed to, which means latex barrier of some kind. Condoms, dental dams, all that fun stuff. Some cases, plaque can build up on the jewelry. Usually brushing it or cleaning it with an anti-plaques rinse or what have you will help remove that. Some people will notice some agitation from the plaque, so it's a good idea to keep it off there if at all possible. Plus, it'll start kind of stinking a little bit. It'll give you some bad breath depending on how big the jewelry is, Anyway, it's a good idea just for general health and well-being. Clean it occasionally. It's not a bad. You can take it out and clean it with like denture cleaner if you really want to be crazy and wild, or take it out and brush it if it's a little bit easier for you. But for the most part, do clean it occasionally. The final thing I'm going to talk about with living with a piercing is nesting. Nesting is where the ball will kind of make an indentation in the top of the piercing. This usually isn't a problem. A lot of people find it a little bit more comfortable and helps to keep the jewelry away from the top of their mouth and help it sit in there a little bit better. You really only need to be concerned about this as during the healing process, if it seems like the tissue is starting to cover up more of the ball than is visible. If that starts happening on either the bottom or the top, see your piercer immediately. We do not want that thing to start growing over the end of the jewelry, because that's going to require some medical treatment to have the jewelry removed. Not a fun experience. Usually to correct it, you can either put in like a dome-shaped or something that has a flat bottom to it, like a disc, and usually this will go away, or a larger bar or ball will usually solve this problem. For the most part, it's not something you overly need to worry about, and you might find it a little bit more comfortable. Now let's talk about abandoning the piercing. If you are at the point where you're just like, I don't want these anymore, the piercing is healthy, there's no signs of infection, even if it's during the healing process or after, removing the jewelry is just going to cause the hole to close. You would want to keep and monitor it just like you would any other puncture wound on your body. If there's any signs of infection or other problems, seek medical advice. Now, if there are signs there that it is in fact infected, I would suggest seeing your piercer or a medical professional before removing the jewelry. And the main reason for that is how your body heals infection. It does that by first isolating that infected tissue and then slowly pushing it to the surface. In this case, through the wound, which is the piercing. If you take it out and that piercing hole the two piercing holes start to close, there's a possibility of it getting trapped in there, and that could cause future problems. And it will probably more than likely need medical treatment to be lanced and drained so that it doesn't. Get where I'm going with this? So if there's any signs of problems or infection, go see your doctor or piercer before you take the jewelry out. One other thing I want to talk about, and I should have done this during the healing, but normal reactions or normal things you will see with this particular piercing is some a white ring of tissue form around the jewelry. That's scar tissue. It's usually opaque or white looking in the mouth. The other thing would be to see this kind of yellowish, nasty stuff, stringy stuff hanging off the bottom. The stringy stuff is discharge. Just like on other piercings that are outside the mouth, that stuff that hardens and crusts the crusties, in your mouth, your body produces it also, and it forms in these long strings. It's nothing you need to worry about. Leave it alone. It'll come off on its own. Well, that's it. Do you have venom bites? What was your experience like? Did you have the excessive bleeding? What have you? If you feel like there's a question I didn't answer, then ask it. Make a comment. Either case, I generally check them when I have time. Till next time, here's hoping that your piercings heal with ease and without a single issue. And if you're in the Des Moines, Iowa area, I would love to see you for your piercing needs in the future. Have a good day, everybody. Take care, and we'll see you in that next video.